because you guys were on mute. I'm pretty sure Gavin played with it.
No. I pressed it by mistake. Okay, so now hopefully folks on Facebook can hear us. That would be nice.
Very.
So we're simulcasting now on Facebook, VMV Hypoallergenics, and on Instagram. And so we'll be talking about hair and nails and stuff. Someone asked about the curly girl method. And, I think my mom can help answer some stuff regarding some confusion about certain ingredients. There's a lot in cosmetics that really is fear-mongering. I think there's a lot of valid concerns about certain ingredients and certain practices and whatnot. But there is also some panic that isn't necessarily true or not true for everybody, or not true in certain aspects. We talked about it in the acne live stream, where a lot of the ingredients online that are called comedogenic are rated that based on really old studies done on rabbit ear assays, which have been debunked, weren't all that consistent back in the 1960s and 70s when they were done, and are really just not as consistent and reliable as studies done on humans, on volunteers, real skin and real conditions. Plus you don't bother the bunnies, which is always nice. So it's not like it's, quote, false or just bad or whatever, but it is based on old data. And not a lot of people maybe know that, or that's not given necessarily in the context. So in things like the curly girl method, we've actually been following a lot of it for her hair. Because
Yes.
Madison, as you can see,
I have curly hair. Then again, I don't really... Well, I do some of it.
yeah. One of the nicer things I discovered, for example, was the whole don't use a regular towel.
Oh, yeah. Use a microfiber which I thought
towel.
it was interesting.
Also, or a
drying.
t-shirt.
Yeah.
And air drying. And this makes total sense. Even for skin, even for sensitive skin, you want to be able to use a softer material, nothing too harsh, because abrasion is irritating. Friction is irritating.
Also, use silk pillowcases for me.
That's right. The silk pillowcase thing is also good. Okay, checking with folks before we start. Audio is okay. We got the crickets back out, but we do have,
Mics,
unidirectional
so it
mic
should be
now.
okay.
So a hypercardioid mic, we should be all right. We have a fuzzy wind barrier thing, so hopefully everything is
a dead
okay.
kitten is what it's called.
I don't like that because it's called a dead. Anyway, okay.
It's a ball of fluff.
All right, so hi everyone. Welcome to our live stream, Skinsights, on hair and nails. Before I call in my mother, Dr. Varalio Rowell, who's sort of the big brain dermatopathologist who will be here answering your questions far more medically, I will be talking first a little bit about VMV and our products for hair and nails and what we normally recommend. People tend to forget that you see a dermatologist for hair and nails as well, right? Keratin, skin. Anyway, she'll get into that a little bit more later. In general, the good news and the bad news is, I guess bad, you're going to hear some of the same stuff over and over again about taking care of your skin and your hair and your nails, meaning avoid the allergens, avoid the irritants, stressors, live well, sleep well, take care of your mental health, all these things. A lot of the same stuff that triggers eczema, rosacea, acne, right, is the same stuff that can cause problems with skin, with nails and with hair, at least the scalp. So the good news is that, to keep clear, doing the same things will benefit so much of you, right? It's not just for your hair or just for your nails, and then you have to do something else for your skin. So much of what you have to do for your skin's health, especially if you have inflammatory skin conditions or atopic dermatitis, like atopic dermatitis, psoriasis, rosacea, acne, will benefit from the same things for a dry scalp, dandruff or seborrheic dermatitis, fungal conditions of the scalp, and then certainly your nails and nail beds. So what we normally recommend for VMV, you'll notice that all of our shampoos, this is Superwash, right? All of our shampoos are hair and body washes. And the reason for that is they're really that gentle. We've never kind of been of the position that a shampoo needs to be harsher so that it can clean the hair more. It should be gentle enough for use on both. Plus, they are really related. I don't know how many people already know this, but a lot of acne, particularly here in the forehead.
I get a lot here.
There you go. Cheeks, the back of the neck, even down here, can be from hair care. Shampoos and conditioners that have comedogens or acnegens or allergens that trickle down, especially with sweat, can clog pores. And remember, comedogens, I don't know if in the States you say comedogens. I forget. Anyway, that just clogs the pore and causes a comedone. And acnegens are things that it starts off as a comedone, the pore is clogged, and then inflammation develops, and then an infection, and that's when acne happens. So of course, allergens and irritants, being irritating, can certainly do that. So those are things to avoid. So yeah, the same gentleness and allergen freeness and non-irritationness that go into what we would do as a body soap, we put into the scalp, into products that care for the scalp and hair as well. We have 3 hair and body washes. The first is, I mentioned, Superwash, and then we have Clark Wash, and then we have Cool and Clean.
I did not know we had the Cool and Clean.
Yeah, and I
What
used it
is
for
it?
you as a baby, so I will get to that in a second. So the main difference between Superwash and Clark Wash is that Superwash is also great as a clarifying shampoo for
Which
those of you
is?
who need it. Like for curly hair, if you have a lot of product for several days, and you really want to remove all that buildup, it's good for that. And it's
that's good
gentle.
for me, then.
Yeah, and it's gentle enough even for curly hair. But
But
for
like-
daily use, you should probably use Clark Wash.
Oh, I don't wash my hair daily, but I use Superwash.
That's true, actually. Curly hair
But
shouldn't
it's
even be
good
washed
for
daily.
me also because I dance.
Yeah, she dances every day. So, yeah. So anyway, so Superwash contains, the big difference is it's a clarifying shampoo, more than Clark Wash. And it has SLES, which I will get into in a little bit, talk about ingredients that have gotten a bad rap over not much understanding. Clark Wash does not have SLES. So it would be recommended more for really, really sensitive skins and scalps, and for dry, super dry, colored or treated hair. Okay?
Treated.
Yeah, mostly, but just treated hair. Then Cool and Clean is similar to Clark Wash in that it has no SLS or SLES, but it also has glycerin and it has virgin coconut oil
Don't both.
for more slide and moisture.
Okay.
And the reason is that it's made for babies and also babies with disrupted skin barriers. And babies, because they're young, their skin is still cycling and all this, they absorb a lot more of what's applied on the skin. So Cool and Clean is for babies. And we also have customers who are undergoing chemotherapy and want something extremely moisturizing, paraben-free, really not irritating. They tend to like Cool and Clean as well. So if you know anyone who's undergoing chemotherapy, Cool and Clean is a great option for them. A note, so here on Superwash's SLES. So SLES is sodium lauryl sulfate. So LAUREL. So SLES, right? And SLS is sodium lauryl sulfate. LAURYL. So SLES is lauryl sulfate and SLS is lauryl sulfate. It's a little confusing, but it's important. Neither of these sulfates are top contact allergens. They're not. And considering how ubiquitous they are, how common they are in a lot of stuff, that's saying something. For something to be a top contact allergen, one of the key things is for it to be present in everything, right? these things are, and they're not top contact allergens. They can be irritants. Just like retinol can be an irritant, alcohol is not a top contact allergen, can be an irritant. And like most irritants, there is a relationship between how irritating they are and how much of it is in a formulation. So for Superwash, it's very, very healthy concentration. It's not an allergen, and it's great. Since the launch of this product, Superwash, I think, was launched in like the mid-'80s. We just don't get any customer reports of reactions to it. And actually, a nice study published in Dermatitis, which is one of the leading journals of contact dermatitis in the world, shows less than 0.1% reactions to our products reported in over 30 years. So, you know what we're doing. This is interesting too about SLS and SLES. I'm going to be quiet first because we have a helicopter passing by. And I don't think there's any mic that's going to help with a helicopter. So I will let that puppy fly by. Okay. So SLES and SLS are both made with lauric acid, which is also from coconut oil. These are different from allergen surfactants, which are cocamidea, cocamidopropyl, something. Cocamidea and cocamidopropyl. Oh, I'm blanking. But you know what I mean. And it's actually not the coconut oil that's a problem there. It's the amido-amine chain that's the issue. And that comes from the processing of the thing. So SLS and SLES are also from lauric acid, from coconut oil. And there's a wonderful review of studies now on vmvinskin.com. It's a study review since the 1970s of studies showing the antimicrobial, antiviral properties of a lot of coconut oil derivatives, including SLS and SLES. So they're actually used for a lot of products for their antimicrobial properties, which is why, like in our clinic and in our factory, we ask people when they come in, part of the disinfection procedure is to wash their hands, including under their nails, but to go up until the elbows using Superwash, and then to wash their faces using a super skin cleanser, which has SLS. So again, while not allergens, SLS and SLES can be slightly irritating. SLS is more irritating than SLES, which is what is in Superwash, and Superwash has lower concentrations of it, but you get also this antimicrobial benefit, which is great. So again, Superwash if you'd like a more thorough, clean, clarifying shampoo. Clark Wash if your scalp and hair are very delicate and your skin is very delicate, maybe you have eczema, and for colored or treated hair. And Coo and Clean for babies and kids, or if you're undergoing chemotherapy, for example, very, very sensitive skin. And then Essence Conditioner is, it's our conditioner. And it's really great, just like most of the stuff for skin that tends to get acne, because it really doesn't build up. It has no residue. So there's nothing to sort of trickle down onto skin and cause acne. And for nails, very quickly, a nice tip on dry cuticles is Boo Boo Balm on the cuticles. So my classic thing is I'll always have like a hangnail, you know, that gets sore, and then eventually for me it'll get infected, and I used to have to take oral antibiotics for it. But now what I do is I just put a big glob. You can see this is almost empty. Like we have tubs and tubs in the house. I'll put a big glob on the hangnail, and then I'll put a Band-Aid on it, and I will leave it on like overnight. I'll redress it in the morning and keep it on again. By maybe the second or third day, I'm fine. Yeah. So anytime dry cuticles and stuff, it's a great thing. Our distributor in Taiwan, Minu, I know uses it a lot for that because they do manicures and pedicures. So there. And oh, quickly, before I forget, stuff that's going on, since we're talking about antimicrobials and whatnot. In the Philippines, we're offering a mini-sized version of our Stay Safe kit with a lot of, like, our virgin coconut oil, a lot of our antimicrobial essentials in a pouch. So it's perfect for when you're making quick errands, going outdoors, or if you happen to be going to work already, it's nice to bring with you. In the USA, we're offering a self-care kit that you can customize with travel-sized products. So if you choose 2 of the travel-sized minis, you get a drawstring pouch. And if you choose 4, you get the bigger travel case, which is really pretty. It's just nice. And it's National Lipstick Month, so I would be remiss if I didn't say all months, all July, it's 40% off lipsticks and lip glosses if you buy 2 of a kind, or 2 of any, I think. And yeah, and all our lip products contain monolaurin also for antimicrobial care. And lipsticks have also virgin coconut oil, which is awesome. Okay, so final quick tip for nails, and I'll call my mom in. When you're applying gel polish and you have to do the UV light thing, you might want to put on Armada. So before you apply the polish and whatnot, just do your sunscreen. Anyway, you should be doing sunscreen every day, right? And don't forget your hands. So yeah, when you do the UV light, remember UV light is an issue. That's UVA, that's visible light, and yes, that's tanning beds, which you shouldn't be doing anyway. And yes, that's the UV light for drying gel polish. So there, all that covered. I'm going to ask my mom to join us to really dive deep into hair and nails. You're going to go? You don't want to stay? You're welcome to stay.
So,
Okay, well, you're welcome to sit there if you want. This is my mom.
Hello.
Dr. Viralia Rowell.
Hi
We're
there.
looking both there and
I'm
there.
looking at both now.
Yes.
Properly worn.
So, dermatologist, dermatopathologist, prominent researcher, over 200 studies published, blah, 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 blah. She's been teaching and publishing and patch testing for I don't know, since the Paleolithic era. And what's been interesting is her dealings with skin and hair and scalp. Because remember things like psoriasis, no?
Right.
Sometimes they actually manifest earliest on the nails, is what you notice, right? I'm not making that up. So say hi to everybody.
Hello, everybody, wherever you are in this beautiful world.
Oh, yay! Thank you.
Even though we have COVID, it's actually opened up a lot of nice, beautiful things because of it. So
Oh, goody.
let's look at the positive.
Let's look at the positive, folks. We can, I mean, what is the point of concentrating on things we cannot control, correct?
Right.
We cannot control 2020. We can control our skin and our health, so we can figure that out. Okay, so nails and hair.
Okay.
Why do dermatologists take care of this also? Are they also skin?
Yes, definitely. The skin's origin is actually something like the tube that develops, when the male and the female thing gets together, and out of that then there's the germ cells that goes into the making of the epidermis, and with that, if you then look, it develops the little tubes that go down and become the house for the hair follicle, also for the sweat gland, and also for the nail. But otherwise, they are keratinocytes, they are similar cells, but have different properties to make it harder on the nail and produce this coming from this little thing here, which is called the proximal fold, distal fold. And then it is where the matrix of the hair, of the nail, then is producing what we call the proximal and the distal and the nail bed. So, but essentially it has the same processes as the development of the hair, of the skin itself. So that's for the nail. And as far as the hair follicle, there's also another dip that has its own epidermis following that into the inside of the skin to produce the hair matrix and the hair channels that cover it, as well as the oil gland.
So it is skin, because keratinocytes primarily, right? The keratinocytes, excuse me. So same cells for the most part make up skin cells, follicles, nail beds.
Right.
Okay.
But with different features about it. Because this one is not hard. This one
Right.
is hard.
Right.
And this one is totally different. The hair consists of 3 areas, by the way. It's called the cuticle in the most outside part. Sorry, it says.
Yeah, I know. I'm going to have that fixed.
All right. So the most outside part is called the cuticle. Then the next is the cortex. And then inside is called the medulla. And the thickness or the width of these three layers varies between Caucasians, Asian skin, as well as in African skin. So
So yes.
depending upon
So hair and nails, yes,
heritage
you need to
as
go.
well.
Wait, I'm gonna
Right.
take this out. We have a thing. Okay. So yeah, so this is why you would see a dermatologist for nails and hair. What are the more common issues that you see, let's say as a dermatologist, for hair, nails, and scalp?
For hair, nails, and scalp. Okay. In the scalp, the most common is dandruff, the milder form, which is also called Psoriasis sicca. That's when you have dry, flaky skin, but
that
without
dandruff?
without the redness. That's dandruff.
Okay.
And
So
then
did you all catch that? Dandruff is this dry, flaky scalp without the redness. So it's a scaling without the redness, and it's called,
dandruff or seborrheic dermatitis, that's mild, or Psoriasis sicca
there you go,
fungus, the
Right.
Pityrosporum or Malaysia organism. It's got something to do with the surface of the skin of the scalp, where the lipids are not quite in balance, the organisms are not in balance. So the Malassezia or fungal organism that is a normal resident thrives more and can produce the inflammation then.
Okay.
Produces seborrheic dermatitis.
I am going to try to whittle this down into stuff that we can really digest. So, to me, one of my biggest take homes when I hear her talk about this stuff is it is just impossible to self diagnose.
Right.
Really and truly. So, here's the thing. Even, I love it. Even, I love it. You look so cool. Seriously.
So the light is so
I
bright.
know,
right?
but
I
I
mean, I'm
love-
not complaining, Lord. Keep it up. But
and
it's bright.
And excuse or not, you just look badass. I think you look great. So truly, so many, even for specialists in the skin, even for dermatologists, misdiagnoses can happen, and not because they're stupid or badly trained, but because the skin, the care of the skin, happens to have so many possible diagnoses, and many of them look very, very similar. Someone asked earlier about Keratosis Polaris, and we tend to get this question so much. And the first thing that we say to them, to our customers who ask about it is, or her patients even who ask about it is, make sure the diagnosis is what it is, because it can be something else.
Correct.
And Keratosis Polaris in particular is very dry, right? And if you think it's sweat acne, you might be treating it exactly the opposite the way you should be treating it. And Keratosis Polaris needs a lot of moisturization. So the person who asked about that, please check. I don't think we have it yet on IGTV, but I know we have something on it on vmvinskin.com. Okay.
I'm glad you took it up about a correct diagnosis and why, if you've got a scalp problem and it's been a while and you've been given a lot of treatments, you have to go to the dermatologist already. And the simple reason that anything can be the cause besides psoriasis, besides seborrheic dermatitis,
Contact.
psoriasis, contact,
Right.
photocontact dermatitis.
There you go.
Because nowadays there's so much exposure to chlorinated and all of these irritated contact dermatitis because of what's going on with COVID. Lots of people are using, I won't name any names, but very highly perfumed because it's strong in chemicals like the alcohol or the chlorine. And so they're in the air, not just applied on whatever, on the hands or the hands. These are photosensitive chemicals.
Right.
And if your hair is a little on the thin side and short side, or in men who are bald, for instance, that can really produce an irritation in the scalp that anybody might call, oh, that's dandruff or seborrheic dermatitis, but it is contact or photocontact
Right. So
dermatitis.
again, don't self-diagnose, especially when something is chronic, right? Because a lot of times, I mean, I grew up in Manila and I grew up in the States. And anytime you had flaking anything, it was like, dandruff, that's it, right? It may not be. It might be, or, it could be a fungal condition. It could be seborrheic dermatitis or an inflammation. It could be a reaction to products that you're using that have fragrance, dyes, preservatives. It could be a reaction to disinfectants like bleach. that we're using now so much because of the pandemic. It could be a bunch of things. It could be psoriasis. It could be other things. So especially if something is particularly chronic, do see a dermatologist. And I wanted to add to this, dermatologists, I've grown up around them, and I know so many of them. And honestly, the ones I love the most are the ones that take the most thorough histories. So if your doctor is asking the most repetitive and voluminous number of questions, all you do is hug. Well, you can't hug them now. You say, thank you, I love you. Because they do need to ask so many questions. What is your job? Do you wear a helmet? Do you tend to wear, because of, let's say, your culture or religion, do you tend to wear a head wrap? Is the head wrap brightly colored? Do you wash it in perfumed laundry soap? All these things might have an impact on your scalp and your hair.
Let me give you an example. Yesterday, I'm the chair of a residency program in Manila, and it's called Skin and Cancer Foundation. So the resident was making a case report, and at the end of it, this particular, what was diagnosed as a psoriasis or atopic dermatitis, psoriasis, was finally, no, I'm correct. It was diagnosed by the resident, because they have to they go through the history, the physical examination, and all that. And finally, the diagnosis was atopic dermatitis, and the patient was not responding to anything. And so the question was, is it time already to give one of these new biologics for atopic dermatitis? So then at the end of all of that, I said, number one, before we go to treatment, how correct is our diagnosis? Is it really atopic dermatitis? Mm-hmm. And I said, okay, like when did it begin? And they said, right from almost immediately after delivery. I said, okay, there you go already. Mm-hmm. Atopic dermatitis, the cells that, the B cells that produce the chemicals that bring out the inflammation, is not mature enough until at least almost 3 months old. So you don't get to say atopic dermatitis until 3 months. Anything that starts earlier is probably seborrheic dermatitis or irritation from the chemicals that is flowing everywhere. I have one baby right now who's 3 months old, but began to have these irritations at age 1.
Okay, so maybe we'll do another live stream on babies. But for now, this is the importance of diagnosis, right? This is why you have to see a dermatologist. Very quickly, I want to get to some questions that we're getting. Minatay91, I love the handle. Are there ways to fix toenail darkening due to tight-fitting shoes?
Don't wear tight-fitting shoes. I'm sorry. Don't wear tight-fitting shoes. Remember, by the way, that one of the skin manifestations of COVID, even before it becomes symptomatic, is urticaria, then petechiae, meaning...
Sorry, do you know what urticaria is? Those are the hives, like they're raised, like swollen bumps, but they're not oozing. Often they can be itchy.
Mm-hmm. Hives is another name for it.
Yeah, urticaria.
And the thing is that another one is petechiae, tiny little dots. Another one is like, when you get the flu, you feel rashy and itchy here and there. But then, blue nails, more large, what we call ecchymosis on the toes, they've also been reported, although that's already in the more serious. But in the milder forms... Is
that because of lack of oxygen already?
It's because of the fact that the blood becomes a little bit more thickened, and so it's easy for the vasculitis occurs.
Okay, interesting.
Right.
But so for the nails and tight-fitting shoes, in general, you probably shouldn't wear tight-fitting shoes anyway.
Two sizes bigger.
But it doesn't do a lot.
It depends upon the socks you're wearing.
Right. But so my daughter does ballet, so you can imagine her toes get a lot of abuse. And classic among ballerinas is toe shoes, point shoes, right? There's just all this banging. So you look at ballerina feet, and the toes, there's a lot of dead toenails and a lot of issues. It's no joke. What I think I would add to that, in addition to maybe loosening up the shoes and maybe wearing sandals, is take care of your feet. At night, feel free to rub a moisturizer on them that maybe has virgin coconut oil and monolaurin to deal with potential fungal issues, and also to get blood circulating. It's also a nice moment of self-care to get the heels as well. That's always a good
Let
thing.
me tell you what I sometimes tell patients who do not have the money to buy a new pair of shoes already, because I flippantly said, get a bigger one. So what I tell them, because they can't afford a pair of shoes, they have one that is really good, but it's tight. What I tell them is slit the side of the shoe at the end, and that will help expand it so that your feet are not like that and expanded forward, but it therefore expands sideways, and they can get away with that. Just a practical solution for those of you who may be out of a job because this is going on all over the world nowadays.
Hey, we do what we got to do, people.
So, yeah.
So, okay.
Slit it and allow it.
A follow-up question also from Minatay is, going on the UV light for drying gel polish, does it actually have to go on the nails? So here's the thing. If in the morning before you leave your house, or just as part of your morning skin regimen, you put your sunscreen on already and you get your hands, then it's already there.
Yeah.
Right? So when you do your manicure and your UV light, at least you have that protection already. It shouldn't futz with your polish.
Right.
It shouldn't.
Remember, the fingers, the toes are one of, particularly in people with the color, those are usually the areas where melanoma begins. Unlike people who are more white and really white skin, the melanomas will appear in other areas like the face, the chest, in the more exposed skin. But darker skin people tend not to have melanoma as quickly, but when they do appear, they tend to occur first in the feet, the nail, around
That's
the nail,
right.
as well as on the hands.
Oh, this is important.
So this is very reason why I totally agree
Yeah.
about talking to you about, please
Yeah, the
put on the
sunscreen.
sunscreen before you have that thing.
Also, something just to emphasize, skin cancer does not pick race. So it tends to be far more prevalent in very light skin tones, very pale, say Scandinavian skin or whatever. But people of color, every skin tone can get skin cancer. And the thing about darker skin tones is because we don't tend to burn. I'm a pale Filipina, but I'm still brown, right? But the darker we get in tone, we don't tend to burn as quickly. So, and we don't also tend to do our annual skin cancer checkup, our annual mole mapping. So we tend to be more laissez-faire about the threat of skin cancer. But it can affect brown skin tones. Bob Marley died of melanoma. Even darker skins can, get melanoma. And she's right. Many times it'll start in the nail and you won't even notice it, right? So sunscreen is really important even for darker skin tones. And if you're concerned about aging, sort of fine lines and hyperpigmentations and whatnot, sunscreen is also a good idea. So asking quickly, I know I want to get to hair.
May I add a little bit to that one?
Sure.
Especially nowadays, again with COVID, and more people are staying at home, indoors. They have to. They better.
Sunscreen indoors, but we did a whole thing on that already.
Ah, okay. I just want to repeat it.
Wear
That-
sunscreens indoors.
Right. That the UV is not just the cause, but UVA that is also delivered by some of the lights, but also the visible light and even infrared. They can produce more oxidative processes that can affect the mitochondria and the cells, so that they also contribute to photo aging and photo cancer development also. So be careful.
So wear it. Okay, I want to get to this because I know it's a big topic before she has to go, and that is hair loss.
Okay.
Let's talk about hair loss.
Diagnose first properly.
Right. So what are the different types of hair loss? What are the possible causes, and what are the possible treatments?
Number one is excessive shedding, which may be due to some stressful situation, so that 2 to 3 months after that stress, like from a high fever due to...
Or giving birth.
Or, there you go, giving birth, or some serious event in the family that really stressed you out.
Anxiety,
Right?
stress, maybe
Yeah.
trauma.
Right. About 2 to 3 months after, the hairs will shed off in lots of it, but there are no round spots. They're just shedding.
Right. So it's no patches
There
of
are no
hair
patches
loss.
of
It's
hair
just
loss at all.
lots of shedding.
Right.
That's
So-
telogen effluvium. Yes.
There you go. Very
I
good.
love it.
She got A on that
I win
one.
a prize. I get a cookie.
So that's telogen effluvium, very common, by the way, especially nowadays with all of the serious things that are going on at any
2020
level of
is no
society.
joke, people.
Right.
Really.
2020, Jesus Christ. Okay. So that's one, common, very common. Another one is alopecia areata, and those are again stress
Sorry.
invoked usually.
So going back to telogen effluvium, really what it is you basically have to wait, correct?
Yeah, be relaxed, meditate,
De-stress. Yeah.
you know, be
Because
stress free.
it's really funny the way when I first heard about it, I thought it was so cute because the way I imagined it in my mind is the hair follicles were like they were like stressed to just paralyzed with fear. And then when you get back to normal, the fever goes away, the trauma is dealt with, you're dealing with your mental health, then they start to relax.
Yeah.
And then they just go back to producing hair.
Right. That's
So-
right. This is correct. Yeah. By the way, before when I was younger, acute telogen effluvium was more common. Now we have chronic telogen effluvium because of one stress after another after another. So make that correct diagnosis because it really doesn't need to be treated for the acute. You just say, wait, you know, be gentle on yourself and all. But for the chronic, help them out with a proper history to find out what are the stresses in that person's life. Maybe it's a recurring infection of the urinary tract, as simple as that.
That's right.
Or some other
That's
chronic
right.
Epstein-Barr virus infection of the upper respiratory area. So that
So
has
yeah,
to be
for
diagnosed.
telogen effluvium, you want to look at actually anything for skin, you want to look at other contributing factors that might be there. Diabetes,
Correct.
thyroid, hormones, stress, mental stress, etc.
Right.
So then we're going to alopecia areata.
These are the round spots.
Patches of
Patches
bald
of
spots.
bald spots. And they vary. Some people, when they get it very early in life, they tend to be very resistant and may even go from just round spots on the scalp to totalis and then universalis all over the body. Again, this is to be properly diagnosed. It may be because then it can be very often related to things like lupus and things that immunological diseases may be associated with it, even diabetes. You know, there are certain skin conditions and systemic diseases where alopecia areata is common. So very often, this is a good thing to remind you of. The skin is the mirror.
I know, I love
Okay?
this. Yeah.
The skin is a front that very often shows what's going on in the body.
Yeah. It's like a window.
Right.
So actually, it's been interesting because she's done diagnoses of endocrine. She's had suspicions because someone will come to see her for a skin condition like darkening here of the neck, something on the nails, patches, whatever. And her patients will come in and say, I'm here because of this skin problem. And she'll look and do a history and look and go, I want to do some blood tests to just rule out some things. And then she'll call in a specialist and it'll turn out to be there's an endocrine thing to deal with as well. Or even HIV or something else, right?
Oh, by the way, seborrheic dermatitis, when it becomes very severe, go have your HIV test.
Right.
Because
And there is no shame, folks. I hope we're way past that already, okay? Just taking a quick question from Ms. Brooklyn. When is the NYC store going to open? We thought soon. We're watching the COVID cases very, very closely because obviously safety first. So if we can get the doors open within the month, we will. It'll be absolutely mask required, probably no facials and spa services yet, but we will absolutely let you know as quickly as possible. We had another question. So alopecia areata, we had telogen effluvium, and then what about,
under genetic
there you go,
alopecia.
endogenetic. This is what most men get?
And some, quite a few women, 40% of women.
And
may
this is the more
have a thin-
generalized baldness?
No, it
What
can
is this?
be mild to more generalized. What it is that the androgenetic alopecia in men and women have the same kind of cause. It has something to do with the receptor of the androgen and all that into the hair follicle. Okay, but it's because women have more estrogens. Their alopecia areata has a different pattern. For men, the pattern is typical. We don't even make, for that one, you don't really make very serious diagnostic unless it's very, very mild. But it's the front hairline begins to recede, okay? and then the
that's
back,
not like mine. Huh? I just have a really, really big forehead because my brain is that big.
because you're my daughter.
There you go. It's from our family, so all
Okay.
love here.
And it starts here to thin out, then it recedes here. And sometimes it just stays like that. But the others, it becomes more and more, and so the whole area becomes bald.
So for telogen effluvium, basically you wait for the trauma to pass, if it's like birth, or a fever, an infection, or you deal with the trauma, you talk to a therapist, get back to mental health and de-stressing, and that can help the follicles sort of relax and start producing again. For alopecia areata, you want to rule out secondary contributing systemic diseases, correct?
Right.
Otherwise, is there anything that can be done for
Oh,
that
yeah.
and for androgen?
Your dermatologist will, depending upon whether they're just a few lesions, will do injections, will do maybe oral medications to get rid of it. And then when it's really generalized, then you really, you have to really see a proper dermatologist who can help you out with that.
Okay.
But
There are things
with
that can be
one or
done.
two, they respond very well to just injection with steroids.
There you go. There was a question also from Ruth. Does the hair shed from the Ruth? Sorry, the question's from Ruth. And the question is, does
About
the
the
hair
root.
shed from the root?
Yes.
Or does it break?
That's a different thing. That's
Yeah.
not telogen effluvium. It sheds in telogen effluvium.
And in these other ones?
Yeah, you have a hair follicle matrix cell. At the very bottom of that follicle is where, and in the mantle, is where the hair follicle germ cells are. So there are three phases of hair growth. There's what we call the anagen growth, which is anywhere from 2 to 6 years, that the hair just keeps on growing so that it has to be cut every month or every 2 months. That's the anagen phase, growth phase. Then it goes to a very short catagen phase of about 2 weeks, maybe a little bit more, and then immediately goes into rest.
Okay.
Just like us, our hair follicles, germ cells, want to rest for about 2 to 3 months, 2 to 4 months. And then after that, the hair follicle now, which has become a little bulb there at the very bottom, it then begins to grow, and then it's able to form now that hair that goes out. So no, it's not a cutting off. That's due to trauma. This one is due to actual biological.
Right. The
responses
follicle
of the hair.
itself is like, no, I'm not in the mood. Whereas hair breakage is in the shaft.
Fracture.
It's a fracture in the shaft.
Right.
So that you need more moisture for
Yeah.
sure.
And that can be due to either
Heat treatments.
yeah,
no?
heat treatments or using too much of these curlers and rollers, and so unprotected, hair that is growing out, So it's mostly due to physical trauma that you
Right.
get that from the things that you do.
We have a pre-question here that came in earlier, which was, how should I care for my bald head?
Depends.
Soap,
usually,
shampoo, moisturizer, what?
Yeah, you should use the mildest because, especially as you grow older, you usually take drugs that are photosensitizers. And so that would mean the overhead light or in the car or walking can make your scalp red. And it's not from the shampoo or conditioner. Perhaps it might be just from the drugs that you're taking that makes your scalp, because it's so barren, photosensitive. So, for the way it is, therefore, what you do is apply a sunscreen also to your to the areas of the scalp
Yeah.
that are bald. So that helps protect you.
Also, if I may add, your bald head is skin. So
Yeah.
anything that can happen to any other skin on your body can happen to your bald head.
Right.
Meaning hyperpigmentation, irritations, allergic reactions, all of that can happen. Holy moly, that's the time. Okay, I have
And
to
then-
let her go soon. I'm sorry. Yes.
Also, contact dermatitis is very common on that bald scalp.
Exactly. And especially like if you wash your sheets, your bed sheets in fragranced laundry detergent, that might be an issue when you're sleeping, right? We have a question about nail psoriasis. I know you mentioned psoriasis can first manifest on the nails, but is there just psoriasis that is isolated to the nails?
Very rare, but I have seen one case actually, you know.
There you go.
Just the nail, nothing else develop on the other parts of the body. Fantastic.
So what is athlete's foot?
I think it's named after athletes because they normally sweat and use rubber shoes, which can be an irritant as well, and the sweating, which is another irritant.
But it's really fungal, no?
It's
a fungal
secondary
condition.
to a fungus infection.
Okay. So antifungals would
I
probably
want to
be
show
a good
you my
idea.
nails. I don't know how much you can see of it. These are nails of an 81-year-old. And I don't use any biotin. I don't use any of those vitamins because there's really no good evidence that it's, you know. I just reviewed the 2020 most recent publications on meta-analysis of studies on biotin, by the way, for hair and for nails, whether it's topically applied or drunk. There are some studies which say, you know, it helped. Well, maybe we can put the bottom line is that when you take those drugs, maybe it will help in people who really have systemic problems also. It helps because there's something to do with the enzymes and all that. But if you have normal body, like I would like to say, even after the cancer treatments that I had last year, that I'm relatively normal. I eat a fairly healthy anti-inflammatory diet, low carbs, you know, minimal oils, and lots of very good oil if I oil, and very good proteins. So vegetables and a little bit of fruits to minimize also my carbs. But look at these nails. My last treatment with chemotherapy was, we should have that as a subject,
Yeah,
by the way.
we should do skin for
Skin
people undergoing chemotherapy.
Oh,
That's
that
a great
I would
idea.
love to talk about that.
And please comment about anything else you'd like us to feature on these lives, okay? But yes,
Anyway,
we'll do that.
there are no fishery,
Okay.
there's no scrape.
Because we have little time. I want to get
Okay,
to some
another
questions that just
question.
came in.
Okay.
One, I have very sensitive scalp and curly thick hair. I'd like to try the curly girl method. Can I use your shampoo and conditioner? She won't know about the curly girl method. I've been reading about it because of my daughter.
Yeah.
Yes, absolutely. The main thing about curly hair,
Here
to
she
remember,
Here she
is that curly hair can get very dry very quickly. You want to make sure you don't shampoo it every day, and a lot of moisture. So what she does now, actually, she doesn't shampoo it every day. She uses Superwash in our conditioner,
Yeah.
but she also uses our virgin coconut oil and does this.
Yes.
I'm not hurting you, am I?
No.
Okay, so she does that pretty much every day to
Yes.
keep it nourished, and the curls look great. There are some things with the curly girl method, particularly how they talk about silicones. The biggest thing that we found that's a little scientifically is the idea that silicones build up and are therefore a pain for curly hair, because as they build up, then you need more clarifying shampoos, which tend to be drying. Two things there. Silicones are actually more like alcohols in the sense that they evaporate quickly. They're not drying. They evaporate quickly, and they give hair a really nice slide, which actually helps with detangling. So that's sort of off. And the other thing is not all clarifying shampoos are really drying. Superwash, for example. So yes, the short answer to that. Sorry, one last thing that I know she needs to answer.
I want to answer that one.
Okay.
May I just add?
Yeah.
The hair, you must remember, is actually, remember I told you about the three, the medulla, the cuticle, and the cortex. They actually have oil, and it's the oil either coming from inside and going upwards or from the sebum. That oil part of the cuticle and the cortex, they are the ones that makes your hair glossy and nice and no flyaway and all that. What happens with certain shampoos which are they strip the oil, and that comes with all of the traumatic things that we do to hair. That needs more oil, and this is why the using of the virgin coconut oil, which are nice, straight, I talked about this before, they're medium size compared to the long of the polyunsaturated, and because they're saturated, they really form nice palisades on the follicle, and makes that hair more hydrophobic.
Okay.
So, any comments regarding waxing or plucking? This is from Sharon. Armpit and leg hairs. How about laser hair removal? Are they safe?
For
So,
what?
waxing, plucking, leg and hair.
As long as you
An
go
armpit
to a
hair.
dermatologist who really knows how to use the
So
proper
this is for laser.
settings for lasers.
The thing about laser, guys, remember, is particularly if you have brown skin, even pale brown skin like me, hyperpigmentation is always a risk. So make sure you go to a doctor who understands phototherapies, particularly for brown skin, to reduce the risk of hyperpigmentation. But laser hair removal totally works. In terms of waxing and plucking, that's physical trauma to the follicle, right? And to the skin. It can be done better or worse.
And it's temporary. It'll come back.
It'll come back. For waxing, I would just encourage you, obviously, go to an expert who is very good, so it's not too hot. We don't cause more inflammation that is needed, more irritation that is needed, not fragranced, etc. Sugaring is a great option because it's cold. And again, just avoid something with allergens. And immediately after, if you can put an anti-inflammatory like virgin coconut oil or monolaurin or red better to really bring that down. Okay, so then, is castor oil good for growing back? I really have to let you go after this. Is castor oil good for growing back or thickening the eyebrows? I haven't seen clinical studies on that.
Castor oil, again, I'm very, I'm a rogue when it comes to coconut oil. Castor oil is a very long chain, polyunsaturated oil also. So it's good because it's oily, but when you compare it with the coconut oil and what it does for healing, contributed by the fatty acids that are just right and that are actually contributory towards the development of any cell membrane that is made of lipids. Lipid bilayer is what it's called.
So not quite. Okay.
I would
how to avoid
coconut
dry
oil.
and brittle hair. You do need the conditioner every day. VCO can certainly help avoid irritants and allergens and treatments. Post-TAH BSO procedure. Hair loss and skin breakout. Do you know what that is? Post-TAH/BSO.
TAH, trans what? I don't, if you
That
can
seems
just,
like a longer discussion and probably to
I'll
have
look it
with
up
your
and then
dermatologist. Also
we can talk
because
about it.
your entire case would need to
Excuse
be
me.
looked at. Okay, guys, I have to let her go. I know she has all this research and whatever, and I'm going to stay a little bit and answer other VMB related questions that I can. But we're going to see her next week. Okay? Bye, everybody.
Take care.
I will do your shout outs to your doctors
You
for
can
you.
tell them, take care. Yeah. Take care. Stay home unless you really have to go out. And when you go out, wear a mask.
VCO monolaurin.
There you go.
Okay. Thanks, Mom.
Thank you,
Love
Daddy.
you. Okay.
Bye-bye.
All right, very quickly, guys. If you abnormal hysterectomy, okay, yeah. So that's the kind of thing. You might have particularities in your case that your OBGYN and dermatologist might want to talk about together. But my mother does sometimes with such cases, like she has some cases where HIV positive and or let's say have involved the endocrine system, she will usually cross consult with the other specialist to try to take care of the patient. So maybe this is time to get your dermatologist and your OB/GYN to speak together. So there, for the most part, like I said, a lot of the same stuff, stay healthy. You see how mental stress really has so much to do with your hair and scalp health. You see how so many skin conditions can be one thing or another. So it's really a good idea not to self-diagnose and to see a doctor, particularly if it's a very chronic condition. Very chronic scalp flaking can be just dry scalp, or it can be already seborrheic dermatitis. It can be contact dermatitis. It can be psoriasis. It can be indicative of other things, as can different types of hair loss, as can different things manifesting themselves on your nails. So a suggestion already is to do a live stream with her about the different skin conditions the different systemic conditions that the skin can give you a hint about, which I think is very interesting. So there, in a nutshell, if you would like any of our products, you can shop them at vmvhypoallergenics.com internationally or .ph in the Philippines. We do have several specials on now. If you have had a patch test, you can DM us here or private message us on Facebook or write us on the website. Share your patch test results with us, and we can customize recommendations for you based on your particular patch test results and even cross-reactants. We'll be here again Friday next week, 9 a.m. Philippines, which is Thursday evening, 9 p.m. Eastern Standard Time. And all replays are in VMV Hypoallergenics on Instagram, in IGTV, and on Facebook, and on our YouTube channel. And let us know, please, in the comments what other live streams you'd like for us to do while I have my mom here, and I can grab her for about an hour while she's really busy with research and stuff. And if you'd like a teleconsultation with her, same thing, DM us, PM us, and we'll make that happen for you, or other doctors at the VMV Skin Research Center and clinics. Don't forget to follow us on Instagram, Facebook, subscribe to emails. I am very game to talk about anything from cocktails to skin to, you know, humanity and equal rights and stuff at Laura@VMV on Instagram. Thank you. Have a glorious weekend. Stay safe and healthy, and love yourselves and de-stress and stuff. Bye, everybody. Thank you for joining us. See ya.